The head of the femur rests in what bony feature of the pelvis? A. The pubic tubercle. B. The acetabulum. C. The pubic symphysis. D. The obturator foramen. The answer is B. The acetabulum. The head of the femur rests in the acetabulum, a bony socket on the lateral pelvis that is formed by all three bones of the innominate, the ischium, ilium, and the pubis. The pubic symphysis is a midline cartilaginous joint between the pubic bones. The obturator foramen is an opening in the innominate through which multiple nerves and vessels pass. The pubic tubercle is a bony projection on the pubis that serves as an attachment point for inguinal ligament. What bone of the foot forms the heel? A. The calcaneus. B. The cuboid. C. The navicular. D. The talus. The answer is A. The calcaneus. All of the bones listed form the posterior portion of the foot. The largest bone in the foot is the calcaneus. It forms the heel and articulates with the bones of the ankle. What is the name for the bones that form the anterior portion of the foot, but not the toes? A. The metacarpals. B. The phalanges. C. The metatarsals. D. The curbals. The answer is C. The metatarsals. The bones that form the anterior half of the foot, but not the toes, are the metatarsals. These are mirrored in the metacarpal bones of the hand. The carpal bones form the wrist, and the phalanges form the toes and the fingers. Which of the following bones does not form part of the pelvis? A. The ischium. B. The ilium. C. The sacrum. D. The ilium. E. The pubis. The answer is B. The ilium. The pelvis is formed by the sacrum and coccyx and the three bones that come together to form the innominate, the ilium, ischium, and the pubis. The ilium is a part of the small intestine. Which of the following structures passes through the superior orbital fissure? A. The ophthalmic nerve, cranial nerve 5, branch V1. B. The abducens nerve, cranial nerve 6. C. The trochlear nerve, cranial nerve 4. D. The superior and inferior divisions of oculomotor nerve, cranial nerve 3. E. All of these. The answer is E. All of these. The superior orbital fissure, an opening in the back of the orbit formed by the lesser and greater wings of the sphenoid bone, has several important structures passing through it. These include the ophthalmic nerve, CN2, the abducens nerve, CN6, the trochlear nerve, CN4, and the superior and inferior divisions of oculomotor nerve, CN3. It also transmits various blood vessels and the sympathetic fibers from the cavernous plexus. Injury to this area can cause a wide range of ocular pathologies including pain, diplopia, ptosis, exophthalmos, and vision impairment or vision loss. Which of the following is not a fossa of the scapula? A. The subscapular fossa. B. The supraspinous fossa. C. The infraspinatus fossa. D. The suprascapular fossa. The answer is A. The suprascapular fossa. The scapula has multiple fossa that serve as attachment points of various bones and muscles of the shoulder. Among these are the glenoid fossa, where the head of the humerus articulates with the scapula, the subscapular fossa, which is an attachment for the subscapularis muscle, the infraspinous fossa, to which the infraspinatus attaches, and the supraspinous fossa, to which the supraspinatus muscle attaches. There is no suprascapular fossa on the scapula. What is the name of the bone that forms the lower part of the jaw? A. The frontal bone. B. The mandible. C. The zygomatic bone. D. The maxilla. The answer is B. The mandible. The bone that forms the lower part of the jaw is the mandible. It is the largest and most inferior bone in the face, and articulates with the temporal bones at the temporomandibular joints. The maxilla forms the upper jaw, while the zygomatic bone forms the cheek and part of the orbit. All of the following bones of the skull help form the orbit except dash. A. The maxilla. B. The palatine bone. C. The sphenoid. D. The temporal bone. The answer is D. The temporal bone. The orbit is formed by the following bones: the maxilla, the zygomatic bone, the frontal bone, the lacrimal bone, the ethmoid, the sphenoid, and the palatine bone. The temporal bone meets the zygomatic and sphenoid but does not form part of the orbit. All of the following bones form the nasal cavity except dash. A. The nasal bone. B. The vomer. C. The maxilla. D. The sphenoid. The answer is D. The sphenoid. The nasal cavity is formed by the following bones: the maxilla, the vomer, the nasal bone, the palatine bones, the lacrimal bone, and the ethmoid bone. It is also formed by the nasal conchae and the septal cartilage. The sphenoid forms part of the orbit and multiple sinuses but does not form any part of the nasal cavity directly. You are taking care of a 22-year-old basketball player who fractured his clavicle while playing in a game. Which of the following blood vessels is most likely to be compromised by the fractured bone? A. Facial artery. B. Internal carotid artery. C. Subclavian artery. D. Jugular vein. E. External carotid artery. The answer is C. Subclavian artery. Of the listed vessels, the subclavian artery is located closest to the clavicle, just inferior to the clavicle bone, as the name, subclavian, implies. As such, if the clavicle breaks and a sharp fragment is formed, it would be most likely to injure the subclavian artery. The internal and external carotid arteries and jugular vein are located within the neck, but more deep and superior to the clavicle than the subclavian artery. The facial artery is located within the face and as such is located very superiorly to the clavicle bone and is unlikely to be involved by a clavicle fracture.